Good day everyone. In current lecture we will continue discussion of pathogenic cocci. Now we'll talk about 1 gram-negative cocci, unique microorganism named Neisseria. Neisseria is a large genus of bacteria. Actually nowadays it is separate family Neisseriaceae, and we have about 10 representatives of microorganisms which are normally found in flora of skin of human and respiratory tract of human body. And we have 2 important pathogenic species, Neisseria meningitidis, Neisseria gonorrhoeae. So any Neisseria is gram-negative microorganism, non-spore forming, obligate aerobic, and diplococci means 2 spherical shaped bacteria arranged in a pair, which resembles some kind of coffee bean, or one bacteria resembles kidney shape in real slides. Difficult to show here because of poor resolution of our microscope, but still. Bacteria classic way described as non-motile, but actually nowadays it is confirmed that bacteria have unique type of motility which is known as twitching motility. Means that bacteria have 4 type of pili which can stick to surfaces, adhere to some surfaces, and bacteria can kind of crawl by surface of our tissues or medical devices. Bacteria is very gentle. It's sensitive to dry and sunlight, almost any environmental factor, and bacteria is very sensitive to disinfective solutions as well. So almost any infection which is caused by Neisseria is transmitted directly from human to human, because environmental objects bacteria cannot survive for long time period. If you will take a clinical sample, and mainly you will study, not mainly, always you will study clinical samples. Bacteria is very often located within our phagocytic cells. You can see incomplete phagocytosis, and bacteria is sometimes difficult to find in environment. You need to apply staining techniques targeted to identify intracellular pathogens. Both bacteria have very common and similar properties. Neisseria gonorrhoeae is kidney shaped in smears when 2 microorganisms stick one to each other. In general, that pair resembles coffee bean, and very often bacteria described as a coffee bean shape. Bacteria is highly pileated, and a lot of pilia found in the whole surface of bacterial cell. They help to attach to cells, to our mucous membranes and skin. It provides resistance to phagocytosis. As well, bacteria have unique molecule OPA protein, which as well is the factor of adhesion. And in diagnostic practice, those pilia are used in reaction of agglutination, because they can agglutinate human red blood cells non-specifically. Bacteria is very fastidious. You cannot cultivate it in any culture media you have. You need unique culture medium. Usually we use chocolate agar or Müller-Hinton agar. Colonies are very small because bacteria is sensitive to environmental factors. It's growing slowly, and colonies are usually a few millimeters in diameter. If bacteria is pileated, then colony can be little bigger and white in color. They are translucent with the granular surface and lobate margins. Neisseria meningitidis is second species of Neisseria genus, as well diplococci, but every bacteria is oval in shape, and when 2 microbes stick one to each other, just inside flattened, and in general it looks like a monococci, but actually it is 2 cells connected one to each other. As well as Neisseria gonorrhoeae, usually clinical samples are in clinical samples bacteria is located within phagocytic cells. Neisseria meningitidis have a good developed capsule, and according to capsular antigen, bacteria is classified into serogroups. 5 serogroups are mainly significant in clinical practice. It is A, B, C, Y, and W135. As well, culture medium required for cultivation of Neisseria meningitidis is chocolate agar or Müller-Hinton agar. Colony are smaller even than Neisseria gonorrhoeae. They are bluish gray and have unique texture, smooth glycerin surface with entire edges. They are convex and elevated above the level of the culture medium. In general, bacteria require specific components added to culture medium. Usually it is heated blood containing animal proteins Growth of Neisseria is stimulated by increased amount of CO2 up to 5%, and biochemical activity for identification of Neisseria as well as for any other cocci, Streptostaphylococci, is not very suitable because fermentation of sugars occurs with acid without gas, and several sugars are positive. So to confirm that you have Neisseria, especially pathogenic species, in your clinical sample, we have two confirmatory tests. It is oxidase and catalase test. As far as bacteria sensitive to environmental factors, as well it is sensitive to concentration and presence of salts, fatty acids and other aggressive chemicals. And actually, if you will use some culture medium to differentiate Neisseria with other cocci, some salt agar or other, bacteria will not grow. It requires only defined culture medium, precise culture medium such as chocolate agar. So we already discussed catalase test with hydrogen peroxide. One more test required for Neisseria, it is oxidase test as well as very simple in technique. We have commercially available oxidase reagent. It can have different names, different trade names and different chemical composition. Mainly principle of the test is the same. You need to take a culture of your bacteria from the petri dish or from other you grow bacteria and add on any paper or some commercially available paper strips. Place some amount of colony here and add a drop of oxidase reagent. If color of your sample became blue or violet, then test is positive. You can perform the test directly on the swab. Take a cotton swab with some colony or material, add a drop of solution here, or sometimes even it is possible to add a drop of solution directly on the culture medium, and if that drop or spot where the drop is added became blue, it means the test is positive. It is confirmation of Neisseria. So we have two species of the same genus but absolutely different diseases. First disease is gonorrhea, which is a sexually transmitted disease. Again, only human disease and present only in human population, transmitted by direct contact. In that case, it is a venereal or sexual transmitted disease. So source of infection is mainly ill person, but we don't really have carriers. We have mainly asymptomatic people, and it is almost always women or women who was infected someday, but they not suffering from any symptoms. Bacteria just present in some amount in mucous membranes of genital tract, and women even do not know that they're ill. So men's asymptomatic, and the main symptom of gonorrhea is intense purine discharge of yellow color from urethra. Initially, disease when microbiology was only in beginning of development or even was not known, doctors thought that it is intense amount of semen which is discharged from sexual glands, and name was given gonorrhea because gonas or gonads, it is a sexual glands, and rhoea is leakage. So gonorrhea actually means leakage of semen. But nowadays it is confirmed that it's not a semen, it is intense pus, but name is still used historically as a gonorrhea. So in classic way it is urethritis. Of course, all symptoms of urethritis will present in human. Pain, itching, burning sensation, exacerbated urination of sexual contact, and intense discharge of pus. We have a chronic gonorrhea when purine discharge is almost absent and symptoms are very poor, but still some pain and discomfort in urethra can present. If you will investigate that subject, then urethra or urethritis, urethral channel will be inflamed, red with some yellow discharge. Disease by itself is not very dangerous, it can recover, but in chronic cases, bacteria can crawl deeper in sexual organs, and in men it can lead to epididymitis, and in women it can lead to infection of uterine tubes with salpingitis, and in severe cases can lead even to infertility because of obstruction of fallopian tubes with some scar tissue and other. And nowadays treatment is very simple. We have modern drugs, cephalosporins, which are active after single injection. Previous years those drugs were not such available, and it was absolutely important and essential to identify disease and to keep that patient in hospital during the whole period of the treatment. And nowadays it's easier, single injection, patient can be not even admitted to hospital the same day, it can go home and you're almost sure that he's healthy. So prevention is kind of simple. We don't have any specific prophylaxis such as vaccines. So the only common measures is avoid multiple sexual contacts, use of barrier contraception, and mess only with known people. Nowadays, gonorrhea test to identify that bacteria is the part of obligate routine investigation of pregnant women and medical checkups during routine checkups. And disease is kind of controlled. But again, we have some group of asocial people, homeless people, and those who abuse drugs and alcohol. They not really come to doctors, they don't have stable job. So that is the source of infection nowadays mainly. And of course, if you're not really sure that subject is healthy, good, and social, it's better to avoid any contact with that human. Again, and nowadays, because of homosexual relationships, it is possible to have atypical location of gonorrhea. It can be not urethra, it can be rectum, oral cavity, and the same symptoms can be located even in throat or rectum. So symptoms will be the same but located in other organs. In the first picture it is throat infection. You see that it is inflamed red glands with the purulent discharge, and usually I will not show you sexual organs, but I think it's kind of analog. It is intense discharge of yellowish color, and the same will be located in man or women organs or in rectum. We have that unique disease which is called blennorrhea or conjunctivitis of newborn kids, and classically it is caused by Neisseria, but actually it can be caused by other microorganisms such as Streptococcus or E. coli or other. But in classic way, blennorrhea is caused by Neisseria gonorrhoeae. It is a kid's disease, but it is transmitted from ill woman who was not checked, who was not treated properly, and when that woman have natural birth delivery, kids go head forward and accumulate all mucus containing in mother's vaginal tract, and actually that mucus will get into the eyes, and very soon after the birth, kid will be infected with Neisseria gonorrhoeae and disease will manifest as conjunctivitis. Actually, they say symptoms: redness of eyes, purulent discharge, and again, conjunctivitis itself is not really dangerous, but a lot of cases of blindness were described for Neisseria gonorrhoeae when chronic damage of cornea will lead to loss of vision ability. Diagnosis actually is not required. It is enough to see symptoms and to know that kid is delivered by natural way. You can study mother, but it's much easier to perform treatment with silver nitrate drops in every eye. Drug is topical, absolutely safe for kid. You don't need any antibiotics or other drugs, systemic one. And actually in almost every country, in developed countries and developing countries, it is the regular measure of prevention of conjunctivitis to give a silver nitrate drops for every kid who is delivered by natural way. You don't even need to check a mother because it's too late. When mother is already came for birth delivery, you will not have time to perform some tests, and it will be dangerous to give antibiotics because kid is still there. So just when kid is born, give a silver nitrate drops in both eyes, and for sure kid will be healthy. Then you will have enough time, if it is needed, to treat the mother. Neisseria meningitis, as it's obvious from the name of bacteria causing serious disease as meningitis. And the same is for any other Neisseria diseases, only human entrepreneur's disease. Neisseria meningitis in literature very often called as a meningococci, the same as Neisseria gonorrhoeae called as a gonococci. You can use that term, it's fine. And actually bacteria was found in other animal species, but it's absolutely not pathogenic for animals. It's only human pathogen. Again, about 20% of adult population have that bacteria as a normal flora of nasopharynx, and we have no symptoms, no problems with that microbe. It's part of normal flora. But if person is sensitive, especially if it is a younger kid, then bacteria can cause very serious disorder. As far as bacteria naturally found in nasopharynx, disease is transmitted by air droplets, and in kids collectives it's very often occurred in epidemic waves, and the whole kindergarten group or class of the school became ill immediately. Disease occurred in 3 stages. First of all, of course, if bacteria invade our body through nasopharynx, first stage of disease will be located in nasopharynx as well. Bacteria will stick to epithelial cells with mentioned villi, and initially it will stick and multiply here in tissues of respiratory tract. And any symptom of upper respiratory tract infection can present in those people, such as runny nose, sore throat, pain in throat, redness, a little swallowing, or some discomfort, coughing, sneezing, any. But it's not really possible to identify that the disease is the first stage of meningitis because symptoms are common and not specific. When bacteria will multiply in enough amount, it will invade deeper in tissues, find some blood capillaries, and spread into systemic blood circulation. And by nature, it is regular bacteremia, but as far as it's a very important disease and it is actually a stage of meningitis, the state is known as meningococcemia because of meningococci causing the disease. It is given with the unique name. In that state, it is systemic infection with multiple invaded bacteria, and of course it will manifest first of all with very high fever up to 40 degrees Celsius. It will lead to thrombosis of small blood vessels because of that villi have agglutinating abilities, and a lot of blood vessels will be trapped with thrombs, and rashes will appear. It is unique type of rashes. It is a petechial hemorrhages of purple, violet, even some black color with defined sharp edges, and I will show you in the next slide that rashes is very unique only for necessary meningitis. And in second stage you can identify bacteria and you can put the diagnosis only by symptomatic presentations. Of course, massive obstruction of blood vessels and rashes and hemorrhages will lead to loss of blood pressure, hypotension, maybe some convulsions will occur in the kids. So that state even is already lethal, and some kids can die in bacteremia stage without even meningitis. But main number of kids will progress to the third stage. Bacteria from blood will invade into the meninges in our brains, and that state will manifest with severe intense headache which will not be released by painkillers. Of course, that increase in intracranial pressure will lead to severe vomiting with nausea, but as well it will not give any release for the subject. One of the very important symptoms of meningitis is a stiff neck, when neck muscles are affected and actually kid is difficult to move with the head. It is a severe state. You can identify meningitis by that stiff neck symptom. If kid is adult able to talk, or you can evaluate reaction of the kid, it is very often manifested by photophobia, when kid is afraid of light with afraidness of loud sounds. If you will touch that kid to perform some examination or palpation, it will be very painful for kid. Kid will try to remove your arm, say don't touch me. Kid will hide under the pillow to avoid any loud sounds or light, especially if you will check some pupillar reflexes with the lighter. Kid will be very aggressive and try to avoid any contact with you. Without treatment, disease is lethal in almost half of the cases, and about 10% of kids will die in first day or few days after first symptom onset. So it is very important to perform rapid diagnosis and to give treatment with antibiotics as soon as possible. So again, usually any meningitis will manifest with the same symptoms, and if you see that it is brains affected, it's important to deliver kid in the hospital as soon as possible without any diagnosis. Of course, run to the hospital to put it in a medical facility to give proper treatment. Of course, systemic treatment with antibiotics is very important. Neisseria is very sensitive microorganism, usually susceptible to simple penicillin group of drugs. In kids it is preferred. In adults we can use ciprofloxacin or rifampin to eradicate caries or tetracycline and chloramphenicol for therapy. And it is very important to isolate ill person. Of course, it is always hospital to avoid serious complications. And you need to find any person who was in contact with that kid, especially if that kid is attending in some collective, kindergarten or school. And you need to instruct parents and medical doctor, teachers in that facility, that if any kid in that group who was in contact will have any symptom of respiratory disorder, immediately go to doctor and check, because it can be meningitis which starts with first stage nasopharyngitis. We have specific prophylaxis as a vaccination, and next slide I will show you. And the main idea that immunity is specific for group of bacteria which cause the disease. Again, we said that 5 groups are most popular and the most frequent. And if kid was ill with group A, then immunity will be against only group A. It is still possible to have second episode caused by other groups of bacteria, third, fourth, even 5. So even if someone will say that I already was ill, it's not a guarantee that that kid will not be ill with the Neisseria meningitis disease again. That is the slide of the rashes. Again, usually it starts with the legs, toes, and spread over the body. So rashes is very unique. It is dark violet or brown, very defined edges, margins, and some doctors say that it's looking like a star sky in the night. Some shapes resemble stars. It is very important to identify the rashes. And if you see the kid and you suspect that it is some problems with meninges, obligate manner you should check any part of the skin. Start with the legs and check arms, abdominal area and back for identification of any element. Even if it is single, in those pictures they are disseminated just to show you, but even if you found some single element, immediately bring that kid to the infectious department. If disease will progress to third stage, it will be not possible to identify pathogen because all symptoms are kind of similar. We have vaccine for Neisseria gonorrhoeae, but as I said, it's not preventive vaccine. That vaccine is almost not used nowadays. Previous decades it was used for diagnosis of chronic cases of gonorrhea. We call it provocation test. Chronic gonorrhea, the main problem is people have no symptoms. Some disorders may be, but mainly you will suspect that a man is ill because a lot of people around who was in sexual contact with that one will become ill with gonorrhea. So to identify that it is really gonorrhea, not any other sexually transmitted disease, that provocation test was used. The main problem that Neisseria gonorrhoeae is located in the urethra, in urethral channel, and it's not invasive disease. And immune response is very weak because it's difficult to find bacteria in the surface of urethra, in the external parts of our body. And immune response is kind of weak because bacteria is not trying to invade. And injection of that cells of Neisseria gonorrhoeae systemically as a vaccine will induce overall immunity. It will raise systemic immune response, and of course our cells will be hyperactivated because now it is invasion of bacteria, and they will try to find that antigenic structure, that pathogen, anywhere, including surfaces of our tissues. And almost always after injection of that vaccine, symptoms of gonorrhea will exacerbate. So to confirm chronic cases of gonorrhea, you need to inject that vaccine, and if symptoms will appear and it became very acute, it is a confirmation of gonorrhea. Of course, it is important to identify every carrier or chronic gonorrhea patient because they are spreading disease in the community. They are not suffering, they will not go for the doctor actually, but it is a duty of the doctor to identify that person and treat. We have the same gonorrhea for treatment of chronic diseases when immune response is not really sufficient. And again, it was used previously when no effective antibiotics were available, they were very expensive. Those vaccines could be used for treatment. So injection of Neisseria gonorrhoeae cells in systemic way in muscles or in blood. Stimulates production of antibodies, and of course those antibodies will help to eradicate bacteria from tissues from our urethra. But nowadays again, that vaccine is rarely used. It is mainly given just for knowledge. If you will make something that is gonococcal vaccine, you should know that it is not preventive vaccine. It is used for diagnosis of the disease. As well, it was mentioned by multiple authors that those people who was vaccinated against Neisseria meningitidis, they have much lower risk to become infected with gonorrhea, or if they are infected, symptoms are very poor or weak, and convalescence rate is much higher. So nowadays it is thought that Neisseria as bacteria of one genus can have cross antigens, and vaccination against Neisseria meningitidis induce immunity against Neisseria genus in general, not only one precise bacteria. So as we said, we have vaccines against Neisseria meningitidis. We call them meningococcal vaccines. And nowadays we have 4 registered vaccines of 2 types. It is conjugate vaccines, which are mainly polyvalent and contains antigens of bacteria of group A, C, Y, and 1W35. Again, it is recommendation of Center for Disease Control and Prevention of USA. They recommend those vaccines in 2 doses. First dose in 11 to 12 years and booster dose in 16 years old. And serogroup B vaccine, they are monovalent, and they are as well indicated for only young adults and teens 16 to 23 years old. Of course, the main group risk, younger kids or first years of life, we have no data about safety and efficacy vaccines in that group, and no indications for vaccination of those kids, and they still remain unprotected. So only common measures of prevention of infectious disease are applied, as isolation of ill people in hospitals and infectious department, and observation and study of contact people and adults who attend in the same or working in the same facilities to identify carriers. We have monoclonal antibodies against Neisseria meningitidis, but nowadays they are used only for diagnosis. They are produced for ELISA test as the diagnostic tool, but they are not used for treatment or prevention. It is only diagnostic purposes. So that is the end of the lecture. We will continue next time. Thank you.